I've been looking for a house with no walls or no whispers, no hiding places, no secret sister. Been looking for a house that won't shelter a lie, no tear-stained past or reason to cry. I wanna live in a house of love.
This is Empowering Women Everywhere, and I am your host, Nan Gill. And today our guest is Dr. Jennifer Vasquez Bryan. She's a primary medical care family physician, and she has her practice in Middletown. And she's doing work that a lot of doctors don't even know how exist. So you want to tell us a little bit about your practice and how it's different than other practices?
Yeah, absolutely. So I opened my office called All2Care Primary Medical Care, and the model is something that's new and innovative and really gaining traction in other parts of the country, called direct primary care. The idea behind it is that instead of focusing on what we do for people and billing for what we do, or fee for service in that moment, in that visit,
Right.
and really focusing on doing more and more and more for people, because that's how we make more money, we say, let's get rid of all of that and just charge a flat monthly fee.
Right.
So essentially that means that people can come and see me as much as they want to within the month, and it's not any extra. Of course, the months that they don't maybe come and see me or email me, they're still paying the fee, but it really lets them kind of spread out the cost of their medical care over the span of a year and use me when they need to.
Okay, and the average monthly payment for that
So
service?
in different practices, it can range from about $45 to $100. I am charging $60 for adults and $20 for children.
Okay. And it actually gives you an incentive to make people healthy.
Exactly. And that's the goal. I think so many doctors are really getting frustrated with the current system, just because with insurance we have to focus on, how many people are we seeing, and we get pressure from the insurance companies, partly because that's how we get paid, is by volume, but it's also organizations. So if you look at other organizations around, the way that they compensate doctors is all about the volume of people that they're seeing. So as a doctor, you're encouraged to see 20 to 30 people a day, but how much time does that actually really give you to sit down, look at the person, right? Address all of their needs, take care of all of their issues, without having to say, you know what, you need to come back next week, you need to come back in 2 weeks, I need to see you repeatedly for all of these things. We're trying to get away from that and really give people the time to be listened to have all of their things addressed. And then that way, they don't need to come back and see me as often, or after that, we can manage things by phone, by email, etc.
Right.
So.
And you also said that you want to have a situation where they don't have to go to the hospital.
Exactly.
Say if they have an emergency, that you're going to be there.
Exactly. So I offer people 24/7 access to me, which means that they can call me if it's an emergency. They can text me if it's not something that's super urgent, but they have a question, or they can email me and I will respond within 24 hours. So yeah, absolutely. I've had a few instances with some of my patients where they call me, they're having an issue, I tell them what to do, and I've been able to save them a trip to the urgent care or a trip to the emergency room.
Right.
I've been able to prevent them from getting admitted to the hospital because we can manage things more easily and more, and I'm more available. Instead of call the office, talk to the nurse, hear from the doctor at the end of the day, I try to respond within an hour, sometimes much sooner than that.
Right. Well, if it's an emergency, I'm sure you're right there.
Exactly. So if I'm with a patient and they leave me a message, I'll try to listen and answer
right away.
Right.
Yeah.
Yeah.
So you're seeing people that have insurance also, correct?
Yep.
Like,
Absolutely.
You mentioned to me that certain patients you have are actually on Medicaid.
Yep. So I see people with insurance and without.
Right.
Technically, because of the Affordable Care Act, everyone is required to have insurance.
Right. Or
by
they have
law
to pay a
now,
fine.
Or they have to pay a fine. So I'm encouraging everyone to have insurance. I mean, insurance is a good thing you are outside, you get hit by a car, you have to go to the hospital. All of those bills can really add up, and that's
Right.
what insurance is for. But it really shouldn't be for the direct care that you get from your primary care provider, right? I mean, if you think about your car insurance, you use your car insurance when you absolutely have to, but you don't use your insurance just to pay for your gas or your tire change or your oil
Right,
change,
yeah.
right? I mean, I
Definitely.
think that's really how insurance should be looked at. I understand health insurance is quite expensive, but there's lots of options that let people pay lower monthly premiums and then take whatever money they would save and put that towards me to overall help them stay out of the hospital, have lower costs for other
Right,
things.
they have a
et cetera.
higher deductible, but they
Right.
generally don't need to use it.
Exactly.
Only in an emergency.
Exactly. And I can a lot of the things that I can do really will help them from not having to go to the emergency room. So for example, stitches, you cut yourself, you call me if I'm available, I'll and it's not too complicated. I can take care of a lot of those things.
Right.
So I really can ultimately save people lots of time. I had a patient the other day actually who, a little boy who broke his finger. He was going down the slide and injured his finger, and his dad called me up and said, he injured it, but it's not getting better. It was like 5 p.m. I said, okay, I'll see you at my office. I saw him at 6:30. I was able to evaluate him. I splinted him. I was able to get the x-ray for him the following day. Sure enough, it showed a fracture. I got him in with the orthopedic surgeon that casted his hand. And all of that saved him and his family tons of time and effort, and they were very grateful. So
Right.
It's those kinds of things that I really can do for people.
Right, right.
Mm-hmm.
And you work with everybody, anybody.
Everybody, anybody. So I speak Spanish, so I'm happy to see any Spanish-speaking people. I see children, I see adults, I do women's health, so I do contraception management, pap smears, endometrial biopsies, all of those kinds of things. I was delivering babies until I moved out here, so I really missed that part. I really enjoyed
new
that.
life.
Yeah. But it's a little bit hard when it's just you all by yourself. Eventually, I'd love to be able to do prenatal care, when women are pregnant, but I'll take care of the newborns. I right now am offering home visits too. So,
Okay.
Say you're a brand new mom. It's so hard, right? I understand I had twins, and if I could have paid for someone to come to my house and see me and my kids without having to take them all and do everything.
Amazingly,
right?
that's
It would have been
amazing.
So I do offer that service to people. It's a little bit extra, but it's just really for me to be available to them.
Right. So tell us a little bit about Health Share.
Yep. So there's health shares are an alternative to health insurance. All right. The one that I work with is one called Liberty Direct. They are a health share that's been I think really becoming more popular as people learn about it.
Right.
And one of the things that's so great about them is that they're not increasing their rates every year, and they have been able to keep their costs low compared to all the other health insurances because they don't have lots and lots of overhead.
Right.
So, for example, what they do is they charge about $200 a month for one individual. Okay, so a person over 30 would be billed $199 a month, and that gets pooled, right? It's essentially like insurance. It gets pooled, and then what they do is they take the money and give it to the people that need it for that.
Oh, wow,
that
that's
month,
cool.
Right, it's a big right. So if you don't have any expenses that month, you still contribute. But if you do, you're able to get that money too. So it's essentially how insurance works. It's just they're a little bit more transparent about it. They only take healthy people. Well, they take healthy people. They will take people with high blood pressure, diabetes. They do charge a little extra for that. But ultimately, if you compare the prices for Liberty Direct versus other health insurances,
Right.
even the super high deductible ones,
Right.
it's significantly less.
Right. So you've been exploring all this
I
stuff.
have. Well, partly, now that I'm a small business owner, I don't have insurance. So I've had to explore, even for me and my family,
Right.
what kinds of options we are going to do. And we chose to do them. So we have Liberty Direct. and they help cover, for the hospital and our preventive visits. So still, like my pap smears, my mammograms, eventually when I need them. All those kinds of things they help cover. But it's a little bit more affordable, and what's great about that is if for example someone signs up with Liberty Direct, they help pay my monthly fee. So you pay your $200, and out of that $200, the $60 for my monthly fee is taken out automatically. So you don't pay any extra. So
that's cool.
Yeah.
Yeah.
So they pay up to $100 per family. So of course with that there would be a little bit extra that the family has to pay for my fee, because that doesn't quite cover my entire fee. But it's nice to know that this group is doing that because they believe strongly in the value of direct primary care.
Now, if you have health share,
Mhm.
does that cover your obligation to have health insurance?
It does. So there actually is a clause in the Affordable Care Act that says that one of these health shares paired up with my direct primary care practice does qualify. So people will be exempt.
Right.
Mhm.
Do you know, and I don't know if you know this or not, but do you know what the penalty is now for not having health insurance?
So right now, I forget, I think it was like $600, or it was pretty
A year?
minimal. Yeah. And then I think it's going up to like $3,000 or something. And I think eventually it's going to get to a percentage. I don't remember exactly, but my understanding is that it's going to be like 7% of your total income. So
Okay.
that can be a sizable amount.
Right.
If you don't buy health insurance.
So even if someone, instead of paying the $600 penalty for not having it this year, they could just pay a little bit more and be covered.
Right. So me by myself, without something like Liberty or
Right.
a wraparound plan, does not qualify.
Right.
But my plan with like a wraparound catastrophic plan
Right.
or Liberty does cover.
Okay.
Yeah.
So there's
Exactly.
ways to make it affordable.
Exactly.
There
Exactly. And even if people, so say for lots of people get their health insurance through their jobs, sometimes those jobs will give them an option of the high monthly premium
Right.
low deductible where they have copays, or the high deductible low monthly premium with a health savings account. If people get that option, what I would encourage is for them to do the high deductible plan
Right.
and get a health savings account, because the money that you save per month then could go towards my membership fee.
Right.
And then whatever is left over, they can actually put into their health savings account that will cover their prescription medications, visits to specialists, if they happen to need an MRI or something else, that will help cover all of that.
So if someone had a particular question
Mhm.
about their coverage,
Mhm.
could they just give you a call
Yeah.
and find
Yeah.
out what might be some options for them?
Absolutely. So I'm not versed in all of the options, but I can kind of help guide.
Okay.
I do have a contact now with the Maternal Infant Services Network based out of Newburgh, and they help get people onto programs so through the healthcare exchange. So if I
Okay.
had a question, I could always contact them, and they could help me out too.
Okay. So what's the best number to reach you
Yep.
at?
So it's 845-510-1870.
Again, what was it?
845
Yeah.
510-1870.
Okay.
Yeah.
And do you have a website?
We do. So it's altucare.com. ALTUCARE.com.
Okay.
And that has all of our information, our pricing. If people want to join, there's a button. They just go on and fill out an application,
Right.
and then we'll contact them. People are encouraged to schedule an appointment just to come meet me. How many times do you ever get to meet a doctor before you are, seeing them for an office visit? Never, right?
Right.
If you don't like me, you don't have to join. If you decide
Who
that you
could
like
not
me,
like you?
thank you. And then we're giving people, if they decide that they want to try it out, they can come in for a physical exam
Right.
and a follow-up, get all the services. So we're charging $120 for 1 month of services. If they don't like it after that month, after their physical and that's it, they can quit at any time.
Okay.
Mm-hmm.
All right, sounds
So.
wonderful. Now tell me, how does it work with the labs and the pharmaceuticals?
Yeah. So, of course, like I said, because everyone technically should have insurance, if they need labs or medications, they can go through insurance. To be honest, sometimes I think paying out of pocket for certain things can actually be cheaper. So, for example, there's medications like there's a blood pressure medication called lisinopril. It's on the $4 formulary at Walmart and Target. And sometimes just paying the $4 out of your own pocket as opposed to going through insurance is actually cheaper. Because even the best insurances will often have a $10 copay. So you can pay $4 or you can pay $10. It's up to you. If you pay out of pocket, it doesn't go towards your deductible, but it's $6 difference, right? So, of course,
those are all the ins and outs.
Exactly, those are the little things. Of course, for other medications, if it's really, really expensive, then it does benefit to go through insurance. For the people who don't have insurance right now, what I'm trying to do is find the lowest cost medication for what the condition they have.
Right.
And then there are programs like GoodRx, and there's another discount card that will give people some discounts on their medications.
Right, so you can actually help them
I can help
find
them. Yep.
what they need.
Yep, absolutely. And actually, it's amazing. Even from one store to the other, it can be a significant change. So
So it's good to explore.
Exactly. And I'm willing to do that work for people because really I want them to save money and be able to get the medications as cheap as possible.
Right.
For labs, I use LabCorp and Quest. I do get a discount for labs. So essentially what happens is people go to the lab, they take my slip, they say that they're self-pay, and they have to pay for their labs at that moment, but they get a 50% discount.
That's a good discount.
Yeah, so that's pretty good.
Yeah.
So there are ways to kind of do things and still save people money.
Right,
Absolutely.
right.
Mm-hmm.
So tell us a little bit about yourself. Where did you grow up?
Yep, so I was born in Mexico. I moved to the United States with my parents when I was 7. My mom is American, my father is Mexican. And at the time, we were looking at different places to move to. My mom's family was in New York, and so we decided to move to Newburgh. I grew up in Newburgh, and I went through Newburgh Free Academy, graduated, and then said, okay, I'm out of here.
Onward and upward.
Yeah, exactly. Not that I enjoyed my experience. I think Newburgh Free Academy actually offered a lot. I think it offers its students a lot of really great things. So I think I was lucky to have had that experience. And then I went to Wellesley for undergrad. Go Hillary. No. She's my alumni. And after that, I did my medical school at Robert Wood Johnson in New Jersey. It's part of Rutgers. And then I went out to Seattle for my residency. So lots of training and lots of traveling, but
yeah. So in Seattle, and then where were you working?
Yeah.
You were working.
So after I finished my residency in Seattle, I went and I worked in a place called Wenatchee, Washington, for a community health center, working primarily with migrant farm workers and underserved people. So lots of people that did not have insurance. Lots of people from Mexico that were there working. There's a big, huge farm community. So if you go to the grocery store and look at the apples, if it's not an apple from New York State, it comes from Wenatchee, Washington. And it'll say on the sticker. They also, all the cherries, from Yakima and
Right.
Walla Walla, that's big, huge cherry community there too. So it was great. It was a wonderful experience. I worked there for about 3 years, and then I just decided it was a little too much for everything that was going on for me, because I learned that I was having twins. So
how many children
I have
do you have?
three.
Okay.
Yeah, so
How
almost
old are they?
4 years. The oldest is almost 4. He'll be turning 4 in September, and then my twins turn 2 in August. So,
okay.
All boys. Yes, it's a handful, but it's fun. They're a lot of fun.
Yeah. So you decided to move back here.
We decided
why?
to be closer to family.
Yeah.
My they're here. My husband's family's in Michigan, so it was kind of like between. And I just figured, I like New York better than
New York
Michigan.
is great.
But it is. It's been. I'll admit, it's been a little challenging for what I'm doing with the direct primary care. It's been much harder here than other states, I think, just because of the laws that they have here in the state. So. But
Well, you're not
Yes.
really far from Pennsylvania.
I know.
You can set up a practice in
Right.
Pennsylvania.
I think you had mentioned that or someone at the Women in Business meeting had mentioned
And you're
that.
not far from Connecticut.
Right.
So you should research
Yeah.
the different laws for the different states.
Right. So I know that in Pennsylvania and Connecticut, they do, they have a thing called the Doctor's Choice, and when you join them, they are able to get you super discounted labs for people.
Yeah.
So say, for example, a complete blood count. Through them, it's like $2. And through the LabCorp thing that I have now, it's like $20. So it can be significant savings for people,
even
but
20
New
is
York
not
doesn't.
bad.
No, 20 is not bad, but just comparatively, when
Yeah.
you're having 5 different labs, it can add up to $100, and if you're paying that
Yeah.
out of pocket, sometimes for some people that can be a little bit hard. But unfortunately, that's all I have here right now.
Yeah. But I would look
You know,
into
but-
starting a
Yeah,
practice.
so I mean, we were thinking about it. I mean, right now, part of the thing was I wanted to stay local because I didn't want to have to commute. Of course, right
Right.
now I'm commuting to Poughkeepsie, and then this weekend I'm working at Northern Dutchess Hospital in Rhinebeck, so that's even further. But that's short term. I just didn't want to have to do a long commute all the time, even though, I mean, to Pennsylvania is like half an hour, but, so I have to
Yeah, it's
see.
not
I mean,
bad.
yeah.
Half an hour is like
There's a
nothing.
little bit of an expense. I mean, it's just a matter of, so then it's 2 different locations. I'd need a Pennsylvania medical license because mine from here doesn't qualify right. And then, but yeah, I think eventually if I get enough, perhaps I don't get enough people here and then I want to branch out. Then I think that's an option. If I can get enough people here, then that would be.
I would know definitely. I would
Yeah.
start it in
Yeah.
Pennsylvania because Port Jervis really needs help, and they're right there, and
Right.
they'd be able to come over.
Yeah. So.
You know what I'm saying? I mean, you can really serve the community.
Oh yeah, absolutely. I think that would be
And you would only have to go maybe 2 days a week.
right. So that would be something.
And that way you'd be able to serve the community there because they really need it.
Right.
That's a
So
community.
what's tricky is one of the things that I offer and what I do is access 24/7. So they're still welcome to call me, but say for example I was here and someone got a gash and they needed stitches. Do I drive to the office,
Oh, yeah.
to do that? Because that's really ultimately what I'm trying to do is save people from having to go to the ER or urgent care and spend
Right.
extra money, right? So that's, one of my friends was like, oh, you should go to the city, and this would be huge in New York City. I'm like, yeah, it's just the commute down there. How do I do that for those acute things? I figured with 3 children, we needed a little bit of extra help. And, we loved Washington. I think the state of Washington's great and just all that it has to offer, but it was just too hard for us to travel across the country to visit our family and for them to get out to us, and we just figured we really want to have grandparents involved. So
With your children.
exactly.
Yeah. So what made you decide to go in this kind of practice?
Yeah. So I knew that I wanted to be a doctor when I was 4 years old. I have no idea how. I remember going to see my pediatrician and thinking that he was the best person ever. That he could cure me and there was something about what he did that I just figured, I want to do that. I want to be able to help people and make people feel better and, make someone that feels sick, feel good again. So I just decided at the age of 4, that's what I was going to do. And that's what I managed to just get in my head, and I did it, right? I mean, it wasn't easy going, sitting and studying for hours on end in
Right.
medical
Oh,
school
there's a lot.
and all of the training and all of it was hard, but I just loved it. I love the connection that I get to have with my patients, to really get to know them and to be, their a support for them
Right.
and their advocate and really just be available. And I mean, it's hard, when people are going through illness, it's scary. And so I want to be the kind of person that they can turn to and not be afraid.
They can trust you.
Exactly.
Yeah.
So that's
And then how did you decide to set up this type
right,
of a
right.
practice?
So once I got out of residency, I kind of looked at my options and I said, yeah, I never envisioned having my own practice ever. I just figured, I'm going to medical school. I don't want to have to worry about business and doing all those things. So I joined the community health center, and I loved it. I really enjoyed my patients, but one of the pressures is always about how many people are you seeing,
Right.
and how much, what's your volume. At that place, I was getting paid by the number of people that I saw. And
Yeah,
if
not by what you did.
No. So it didn't matter that I made them healthy, or that they had a really great experience, or that, I caught a cancer or something. It wasn't anything about that. It
Right.
was, how many patients are you seeing a month?
Right.
If you're not seeing the number of patients per month, you need to do more. You need to, come in on weekends and see extra people. And I didn't want
That's
that to
not
be
where
it.
your
That's
heart
not where I
was.
was.
Yeah.
I was the only female doctor working full time in that organization.
Right.
That says a lot. And the reason that none of the other women did it was because they couldn't. They
Yeah.
just felt that they could not balance their family. They couldn't balance the demands. They
Right.
couldn't treat their patients like they needed
Right.
to. And after a while, I just said, I can't do this. I can't
Right.
continue to be a good doctor and just have the pressure of, and then feel that I couldn't be with my family.
Right.
My medical director at that time told me, Jen, your first job is as a doctor, and if your patients need you on a Saturday when you're at home with your kids, then you get up and leave and go take care of your patients. And I said, I'm sorry, but that's not, I'm doing that now for my patients, but I'm not doing that for them the way they wanted it to be
Right.
done, right? It has to be a balance. And when I was working, in the hospital and got 2 hours of sleep, and it was this thing and that thing and all these, I couldn't do that. So
Yeah.
that's what I was really getting burned out. And even after I moved here and started my practice here, it was the same kind of idea. See more, do more, and that's not the kind of doctor I want to be.
You
So
want
I
to be
was-
somebody that can get to know your patient.
Exactly.
And that is beneficial to you to make them better.
Exactly. I mean, that's, I want to, be able to spend the time talking to them and finding out, how their family is and what's going on with them and what their living situation is. I mean, how am I supposed to fix someone's diabetes when all they have access to is, food from the food pantry or something? I mean, how do you do that? But you don't
Right.
really get to know that unless you are able to ask the questions.
Right. And talk to them
And
about
talk to them.
nutrition. Right.
Exactly.
Definitely.
And so that's really, I came really close to quitting medicine. And I felt like I had worked too hard with everything to just let it go. So I saw this as my saving
Yeah.
myself from, it's just a way to save everything that I had worked for and not give up.
Right.
So,
So if you're interested in meeting Dr. Jennifer Vasquez Bryan, give her a call.
absolutely.
And your number again?
It's 845-510-1870.
And no obligation. Come
No.
in, meet her,
Meet her.
see if it works, see if she can find a way to make it actually be more cost efficient for you to have her on your team.
Right.
Okay.
Absolutely.
And thank you so much for being here,
Thank you.
Dr. Vasquez Bryan.
Appreciate it. Thank you very much.
And thank you for the work you're doing.
Thank you.
I've been looking for a house with no walls or no whispers, no hiding places, no secret sister.
Hi, my name is Nan Gill, and I'm the host of Empowering Women Everywhere TV. Empowering Women Everywhere TV is a show that's designed to showcase women and men in our community that do an amazing job to make this world a better place. Find out about what other people are doing, and if you have someone that you know, or if maybe you are someone that should be on our show, please contact us at empoweringwomeneverywhere.tv. and let us know so that we can have you on our show. We look forward to working with you. Have a great day.